You've chosen a long-lasting method of contraception that's over 99% effective. The doctor or nurse who fitted your coil will have discussed with you how long this will last for and how quickly it will start working. It's normal to have some cramping. This can feel like bad period pains, which should get better after a few days, but using a hot water bottle or taking paracetamol and ibuprofen can help. At the clinic, we talked about bleeding patterns. You may have some light spotting after a coil insertion, and this can last for several weeks or months. If you have a copper coil, your periods may be heavier, longer, and more crampy initially, but this often settles. If you have a hormone-releasing coil, it's normal to have some spotting or bleeding for 3 to 6 months, daily spotting, irregular bleeding, or brownish discharge. But this should settle to light, regular periods, occasional spotting, or no bleeding at all. You may also experience cramping pain before a period. At the clinic, we'll have trimmed your coil threads to 2 centimetres. So, we ask you to check your threads 4 to 6 weeks after insertion and then once a month or after heavy bleeding. Lying down, or in a squat position, insert one finger into your vagina. At the top of your vagina, you should be able to feel your cervix, the opening of the womb. It will feel firmer than the softer vaginal wall, like the tip of your nose. You should be able to feel your threads easily. If you can't, we recommend using condoms or avoiding sex until the position of your coil and threads have been confirmed by your sexual health clinic or GP. It's possible for your coil to move or fall out. If this happens, you might have pain or notice longer or missing threads or a change in your bleeding pattern. It's unusual for this to happen without you noticing, but it is possible, especially if you've also experienced heavy bleeding. You may not be protected from pregnancy, and it's important to avoid sex or use condoms until the position of your coil has been checked. At the clinic, we do an internal examination to look for your threads. Sometimes an ultrasound scan is used to confirm your coil position, and occasionally an X-ray may be needed to locate the coil. You should contact your local sexual health service or GP as soon as possible if you experience pain or bleeding during sex, or lower abdominal pain, if your bleeding pattern worsens, if you have a change in your vaginal discharge, or if you feel feverish or generally unwell, if your threads are missing or lengthen, or if you feel the device in your vagina. If you have a positive pregnancy test after you've had a coil inserted, then you should also contact your local sexual health clinic or GP as soon as possible for advice. Your coil can be removed in a sexual health clinic or in some GP practices, and in most cases this is usually very straightforward. Sometimes, if the threads are not visible, it may be necessary to use a special instrument to retrieve them, and in very rare cases, an anaesthetic may be required to remove your coil. It's important to abstain from sex or use another form of contraception in the 7 days before removal or replacement of your coil. So, ask your sexual health service to supply you with free condoms. And, if you'd like your coil replaced, this can usually be done during the same appointment. After your coil has been removed, your normal fertility will return.